my name is Doris Ponce. I'm associate professor of medicine. I'm a Sloan Cancer Center that's in New York. And I am a hematologist oncologist and bone marrow transplant by training. My area of research interest is the post-transplant complications, especially graft-versus-Host Disease, also acute leukemia, MDS, myeloproliferative disorder. I lead the Graft-versus-Host Disease Program at Sloan Kettering, and I also design and lead investigation on clinical trials in graft-versus-Host Disease. The AGAVI trial is prospective randomized trial and for the investigation of axatilimab for the treatment of advanced chronic graft-versus-Host Disease. The randomization was using different doses of axatilimab. There was a low dose, intermediate dose, and a higher dose. And the patients who were accrued for the clinical trial were steroid refractory chronic graft-versus-Host Disease who have received at least corticosteroids and another line of therapy to be eligible for the trial. So in this analysis, the primary endpoint was treatment response. However, there were secondary analyses that were conducted, including the evaluation of bone marrow density. The rationale for it is because axatilimab is a drug that tackles the colony stimulating factor receptor. It's a monoclonal antibody, so it's a CSF1 on our monoclonal antibody with high affinity to the receptor, and it does deplete monocyte and macrophages. There are the main drivers for inflammation and fibrosis in chronic graft-versus-Host disease. But we also know that colony stimulating factor 1 has a role in bone remodeling pathway, and models that have knockout for CSF1 has severe skeletal issues. So there was the hypothesis that axatilimab could influence bone mineral density remodeling during their treatment. All patients who participated on the trial were eligible for the secondary analyses. And basically, there were 239 patients who were evaluable who received the drug. So in this analysis, all the bone-related medications were documented, like calcium supplementation, vitamin D, phosphonate therapy as well. And also, if there was any concomitant or current medications being used for bone health, and also assess if the patient were on corticosteroids or not. As we know, corticosteroids can impact bone mineral density in a negative way. And interesting, most of the patients, 65% of those, were on concomitant corticosteroids at the time, at their baseline assessment at the time starting axatilimab. So we assess their bone health at baseline and then during treatment. And we also assess for markers of bone mineral density activity just to evaluate if there was any influence of axatilimab on this endpoint of bone health. Um, so what we found is that many patients had a baseline of bone-related issues, like for example, osteopenia, osteoporosis, and osteonecrosis. And then during the treatment course, we found a subset of patients that had osteopenia. Out of the 239 evaluable, there were 6. Osteoarthritis, there were 5. Osteonecrosis and bone pain, there were 4. And we also found some patients that had bone infarction and other issues in a small number. We assessed the risk of fractures, and we found that 17 patients, which is 7.1%, had at least one fracture, and 2 or more fractures occurred in 3 patients at 1.3%. In this analysis, as I mentioned, we investigated for baseline bone-related alkaline phosphatase and CTX, which is a marker of bone health. And we found that there were no significant changes on the bone markers compared to baseline during treatment. And what we conclude is that that there were minimal changes in the bone turnover markers as we observed. However, the events of bone-related treatment-emergent AEs were very rare. For patients to be two-thirds of the patient, approximately two-thirds of patients to be on corticosteroids, the number of fracture, including multiple fracture, was noticeably low for this type of population, and they didn't seem to have worsening of their bone mineral density throughout the study. So this is preliminary but interesting, and we believe that subsequent follow-up and longer follow-up will help to determine if axatilimab does have an effect in bone mineral density. And of course, so some additional studies and analyses are needed for meaningful conclusion, but at least we found that it didn't impact in a detrimental way, and it seems to suggest some positive outcomes.